Welcome to the Single Best Answer series from the UCL Centre for Anaesthesia. Don't worry if you don't know the answer straight away. They're meant to stimulate your learning and develop your critical thinking. If you'd like, you can discuss the single best answers with an anaesthetist in theatre. Press pause now while you read the answers. Press play when you're ready to see the correct answer. So this question really is about someone who is bleeding heavily. She's from a at-risk group of patients that are at risk of hemorrhage, she's had a child. This is a postpartum hemorrhage. The surgeons have said they've had a large amount of blood in her pelvis and she's still bleeding. Hemoglobin 6, of course, that's abnormal. We know it's normal from about 11 grams per deciliter. She's AB positive and she's got a hypotension with a sinus rhythm tachycardia 150. So this is a very serious situation. This is a life-threatening situation. There's also a problem with the blood bank. They will be operational again in 50 minutes. There is some blood in the obs theatre fridge you can access. Okay, so let's go through all of them. 3 units of O-negative blood through 2 blue cannulae. Well, you know probably that blue cannulae are small, so no, not to A. B, she needs IV beta blockade to slow her heart down. Of course, you are not going to try and slow someone's reactive tachycardia down from 150 beats a minute. If it's sinus rhythm, you will let her heart do what it needs to try and compensate. C, 3 units of AB negative blood through 2 blue cannulae. No, we don't want any blue cannulae. Blue cannulae are small. D, 6 units, that's right, of O negative via 2 grey cannulae. That's what you want, 2 big cannulae. And we're going to get 6 units to start with of O negative blood. That's the universal donor blood, right? Okay. E, colloid or crystalloid via 2 grey cannulae until cross-matched blood is available. Well, she is still bleeding and her hemoglobin is 6, and her heart rate is 150 with almost no blood pressure. So, of course, initially, for the first few minutes, you'll get any fluid into her, but immediately you'll send someone off to the blood bank to get O negative, which is flying squad blood. In most hospitals, you'll activate the major transfusion or major hemorrhage protocol, which means the blood bank will be alerted. They will probably come with a specified amount, perhaps 6 to 8 units of red cells, a round of FFP, a round of platelets as well. That's a little aside. So the answer here is D, 6 units of O negative via 2 grey cannulae. Press pause now while you read the answers. Press play when you're ready to see the correct answer. Okay, this is about the same patient who has been resuscitated. This is actually from a true patient. Of course, not her real name. So 15 units of blood, so that's a massive transfusion, 9 units of FFP, 2 units of platelets, and 1 pool of cryoprecipitate. So we're thinking about what the side effects are of a massive transfusion. We should bear in mind that blood is stored in the fridge. Blood is anticoagulated with an anticoagulant that lowers the calcium. That's how it works, basically. Citrate lowers the calcium. And of course, blood cells, as soon as they're taken out of the patient, start to lyse, releasing potassium. So there we go. That's the answer, really, isn't it? So A, well, the potassium may be high. The calcium will be low, probably, in this massive transfusion. But the body temperature we would not expect to be high because the blood will cool the patient. It's true that we try and warm the blood, but we are not always successful at that. B is wrong because the potassium won't be low and the calcium won't be high. C is potassium high. Well, that's correct. Calcium low and hypothermia. So this is the correct answer, C. We can exclude D because the calcium won't be high in D and the patient will probably not be warm, and that we would not expect the potassium to be low either. So to recap, blood stored in the fridge for 35 days, that's packed red cells, cools the patient, of course, if it's not fully warmed, can raise the potassium, and can lower the calcium in a massive transfusion when you're transfusing quickly over a short period of time.